So anxiety can manifest in many different ways, and actually people suffer with anxiety in different ways. Common symptoms include sort of worrying excessively, so you're worrying all the time to the extent that it's taking over your thoughts most of the time and it's interspersing your thoughts every day. Anxiety can also affect your concentration, and there are also very physical symptoms of anxiety where you have palpitations. You can actually feel your heart beating very fast. You may even get chest pains. You feel that you can't breathe so well, you can't take a deep breath in. And all these physical symptoms are actually very real. So there are physical symptoms as well as what we call sort of psychological or cognitive symptoms. But anxiety can present in many different ways for different people. The key is to actually identify what is anxiety that you would expect when you are facing a situation, and what becomes anxiety that is out of proportion to the situation that is now out of control, where it's taking over your life and it needs to be managed. So it's where is normal response to a difficult situation, and where your anxiety is now past that stage where it's not so manageable and perhaps some help and intervention is needed. If you start to experience these physical symptoms all the time, you're hyperventilating, you're getting chest pains, you can't take a deep breath in, you feel there's a lump in your throat, and you can't seem to be able to talk yourself out of it or rationalize yourself out of the situation, then perhaps that is the time to get help. Getting help doesn't mean that you need any sort of drastic interventions. It doesn't mean if you come to speak to a doctor that we will naturally prescribe a medication. Sometimes by sharing it with a doctor for us to say, yes, we expect that, would be enough to reassure you, and you can be on the way to manage this yourself. Sometimes we need to get help from a therapist you might just need a session or two to speak to a therapist who would then help you through that. So it doesn't mean coming to speak to a doctor or to speak to a healthcare professional means that there's going to be a drastic intervention.